series, we're going to talk about how to position for a wrist x-ray. So I have our wonderful volunteer over here who's going to be our patient. For our wrist x-ray, we're going to just start with the PA view. So you're going to take your patient's hand and put it nice, and remember we talked about in the middle of the cassette, if you remember talking about the crisscross or hash marks on the actual cassette itself or the detector. So we're going to put the wrist right in the middle there. So if you can see on the side, there is some space, especially on the inside of the wrist, that you have to account for. And the way we manage that is actually making the patient cup their fingers down, and it actually brings the wrist closer to the detector itself. So you'll want to have your patients do this. Don't have them, clench and white knuckle type. Just have them cup their hands just a little bit, again, to bring the portion of the wrist closer to the detector. So now we're going to center the light and collimate down. So you want to make sure you have the carpals and the metacarpals, and then a third of the radius and ulna. We're going to collimate side to side there. And as always, make sure you're at 40. And I'm almost there. There we go. 40. Okay, and then I'm going to grab my marker, and I'm going to mark on the outside of the patient's hand. Okay, so that is the AP or PA view, I apologize, of the wrist. Okay, so now